Thank you for choosing SolRx Pharmacy Review Program. The purpose of our videos is to better prepare you for your qualifying Part 2 exam. You will now have the opportunity to watch a presentation which will provide you an orientation of the exams. Secondly, some videos that will showcase some scenarios, followed with a quick review by a pharmacist. Wishing you all the best for your exams.
Hello and welcome to SolRx Pharmacy Review Program. Today, in this program, we are going to provide you orientation for the qualifying exam 2, that is OSCE for the pharmacists. A brief introduction about SolRx. SolRx was started in 2009 by two pharmacists and today is known as Canada's premier pharmacy review program. It's 100% owned and operated by Canadian registered pharmacists. If you are a part of the SolRx in-class review program, you can be assured with the quality of the program. SolRx offers 110% money back guarantee. If for any reason you are not satisfied with the program, you could opt for money back guarantee. Obviously, fair terms and conditions apply, and the money back guarantee is on satisfaction with the quality of the program and not pass and fail. It's important for you to understand that SolRx Inc. and its review programs are neither related to nor endorsed by Pharmacy Examining Board of the Canada. It's actually neither endorsed or related to any of the regulating authorities in Canada. SolRx Inc. conducts review programs and no way provides any kind of certification. If you are reviewing this CD because of the book that you requested for, then just a bit note about the authors. My name is Bhavin Desai. I'm a registered pharmacist, certified diabetic educator, and also holds a degree in management. I'm licensed in Ontario since 2008. The co-author for this book is Vipul Shah. He is also a registered pharmacist in Ontario since 2008 and holds a Master's in Business Administration. Introduction to OSCE, Qualifying Exam 2 for Pharmacists. So OSCE basically stands for Objective Structured Clinical Examination. It's considered to be one of the toughest exams by most international pharmacy graduates, and for that matter even Canadian or American pharmacy graduates. So high pressure exam and communication is a key weakness area for most foreign pharmacists. The exam is about 3.5 to 4 hours long. There are about 15 stations. Just make sure you look at the PEBC website www.pebc.ca for the most recent updates and basically make notes of that. But as of now, based on the website, there are 15 stations in the exam. Out of 15, there is one is a pre-test stations, so essentially 14 scored stations. Out of that, this is the estimation based on previous information. Right now there is no particular information, but based on the previous information, out of the 14 stations, most likely you will have 12 to 13 interactive stations and 1 to 2 non-interactive stations. Each station is 7 minutes long. There is 2 minutes between stations. There is a buzzer that indicates the start and finish of a station. After 5 minutes, there is a warning buzzer. It just tells you there are only 2 minutes remaining and it's time for you to wind up. Once the 7 minutes buzzer is gone, no matter what you are doing, the station would end, and no matter what you say, you will not be marked for whatever you say after 7 minutes. There are going to be adequate references in each station, and you can refer to them at any given point of time. This is an open book exam, but just remember you have only 7 minutes, which means you can only spend so much time looking up a reference, and which means you need to be adequately prepared so that you don't have to look or go back to references quite often, because it's going to consume time and cost you the station. So let's look at the interactive stations. What are the different types of the interactive stations? The different types of interactive stations include counseling stations where you have to counsel on a prescription drug, counseling station where you have to counsel on OTC or over-the-counter medications or make a over-the-counter recommendations. There could be a doctor or healthcare station where the healthcare professional comes for a query or is requesting a solution and you need to provide that. There could be a management station and demonstration of devices. So these are the broad categories of interactive stations that you could come across. So what you exactly need to do in a counseling of a prescription drug. So irrespective of the station that you get, these are the broad things you might be expected to do. Gather relevant medical history of the patient. Identify and resolve a DRP or a drug-related problem if there is one. Provide counseling on drug and disease. Provide self-care measures. And finally end the patient care with a follow-up. So these are the essential broad steps that you need to perform in each prescription counseling station. The same thing, pretty similar, would be there for the over-the-counter recommendation or where you would be making a counseling on over-the-counter products. Once again, you need to gather relevant medical history, but more importantly, you need to also focus on the current problem, why the patient is coming, and what help they are seeking. Rule out the red flags for their current condition. This is very important because if it needs or warrants a visit to the physician or the emergency, then you must be able to provide that. And in order to do that, you need to identify the red flags. Identifying and resolving a DRP or a drug related problem, that's an essential part. Providing counseling on drug and disease, providing self-care measures, and finally ending up the station with a follow-up. As regards to the healthcare station, in this kind of station, the healthcare professional, either a doctor, nurse, or someone else, is looking for some information or solution. As a candidate, you need to gather relevant medical history or medical information, look at your references, and then provide the solution or provide the information. You might be required to document your solution, so make sure you don't leave the station without documenting it. Management stations. The key part here is to identify a problem based on gathering the information from the situation or the person who is present and then providing a solution to the problem. So that's a very broad based approach to the management station. The key thing you need to keep in mind is be objective in gathering information, identifying the problem, and once you identify the problem, just don't look at the immediate solution. Also think of how you could help prevent this situation from happening in the future and try to work on that solution as well. Finally, demonstration of device is another interactive station. Here a person or a patient is sitting or coming and needs you to explain how to use a device. The essential parts of this station are basically to making sure that they have got the counseling or they don't need the counseling, and all you need to do is demonstration of the device. The reason I say this is because there could be two types of stations. There is one station where there is exclusively what is required of you is to demonstrate the device. In others, it could be a mix or a combination of providing counseling on the prescription drug and then demonstrating the device or how to use that device. So just make sure you know what exactly you're supposed to do, and then let's say you know that you have to you are just supposed to demonstrate the device. In that case, the quick way to run through is identifying the different parts of the device, explaining the steps, breaking down the steps into few easy simple steps, and making sure that the patient or the caregiver understood each part and answering any queries they may have about it. So this is once again the summation of the interactive stations: counseling on prescription drugs, counseling on over-the-counter drugs, or making a recommendation for minor ailments, doctor stations or healthcare stations, management stations, and demonstration of device. Now let's move to the next section of the OSCE, which includes non-interactive stations. So what could be non-interactive stations? So essentially, just like any interactive station means you are interacting with someone and trying to solve a problem. Here it's a non-interactive station, which means you're not interacting with anyone. There is a reference, the problem or the task is laid out in front of you, and all you need to do is provide the answers. So the non-interactive stations can be very broadly classified into a few different parts. So the first type or first category of non-interactive station could include prescription dispense checking. Another is prescription screening, article reading and providing answers, and retrieving information from a reference. So let's look at prescription dispense checking first. So the prescription dispense checking, here what actually happens is there is a prescription written by the doctor, there is a pharmacy label, and actual drug and vial with the label are there on the table. What essentially we are checking here is this: the doctor provided a prescription, the patient brought in a prescription, that same prescription was transferred onto the computer system of the pharmacy, and then it was filled. So now we are checking basically three things. One, what we are checking is the prescription drug or the prescription that was written by the doctor. Was it accurately transferred onto the computer system? How would I know that? I would check the prescription of the doctor versus the label printed on the pharmacy system, and that's how I would know if it was accurately transferred onto the computer or the pharmacy system. That's one part. The second part is when the prescription was transferred accurately on the pharmacy computer system, did the pharmacy assistant or the pharmacy staff fill the prescription as per the label? So that's the second part. So for example, we were supposed to fill amoxicillin 500 milligram 21 tablets. Now what we need to make sure is, did the pharmacy staff fill 500 milligrams of amoxicillin or did they fill 250? So essentially what you're checking is the right medication strength was filled based on the computer system or based on the prescription written by the doctor. So that's the second thing. So what you're now going to check is the right drug filled? And the third thing you need to check is open the vials and see if the right drug is in the right vial. So for example, for one patient there are two medications. One is amoxicillin and one is naproxen. Now what you need to make sure is the right drug in the right vial. So let's say there is a drug vial that says amoxicillin. Now you need to open up and see, is amoxicillin capsule inside it or is that naproxen? So that's what essentially we are doing. So what we are doing in dispense checking, three things. Essentially checking if what the doctor wrote, exactly that thing was transferred on the prescription. That's one. Then what we are checking is, based on the prescription, did we fill in the right drug? And then the third is the right drug in the right vial? So that's very important. So three things we are checking in the dispense checking. Prescription screening. In this station, what you have in front of you is a prescription written by the doctor. What you need to identify is if there is any error before you or the pharmacy would like to process the prescription and put it on the system. So here are the things that you need to run through. So the first thing you need to, when you look at the prescription you're looking at, is check with the drug related information. Is the drug prescribed is right, the right drug, the right strength, right dosage form, right dose, right frequency. In terms of patient related, you need to check, is this the drug appropriate for the patient based on his age, medical condition, weight, etc. And finally, prescriber. So is the prescriber prescribing this medication? Does this drug fall under his scope of practice? Is it a US or a Canadian doctor? And those are important things. So just to give you an example, for example, ciprofloxacin is being prescribed and the patient is a 5-year-old child. So usually what happens is ciprofloxacin is contraindicated in patients, in children. So what you need to then identify is that there seems to be a problem. The drug could be correct for the treatment of UTI, or community acquired pneumonia, but the thing is it's not appropriate for the age. So that's a drug related problem you identify. Then there could be other things. For example, metronidazole is prescribed for urinary tract infection. So now the drug could be right, but it's inappropriate for the condition, or it's inappropriate for the current condition the patient has. Similarly, prescriber's information is very important. For example, a dentist is writing a prescription for simvastatin. It's outside his scope of practice. There is a prescriber who's a physician, but he happens to be a US license holder. Obviously, we cannot honor the prescription from US. So those are the things that you need to keep in mind when you're screening the prescription. Article reading. So you could be provided an article, and based on the article you need to find the answers to the questions posed at the end of the article. The key skills required here is obviously screening quickly and basically scanning the whole article, looking for key clues and trying to identify the answers. A key thing that might benefit you is basically first read the questions and then try to read the article. This will give you a more sense of what answers you're looking for and help you quickly identify the answers. Retrieving information from references. So there could be some reference placed in front of you in the station, and there might be some information you are required to retrieve from that information. So essentially the key thing is you need to be well versed with the references. Some of the key references you need to be well versed with is physical copy of CPS, Martindale, pediatric dosage form, therapeutic choices, both kinds, the therapeutic choices and therapeutic choices for minor ailments, and Martindale, and those are some of the books or references you need to be well versed with. So essentially, once again, summing up, what are the non-interactive stations that are possible? Broadly, there are different categories: prescription dispense checking, prescription screening, article reading, and retrieving information from reference. Now, before even we start preparing for the OSCE exams, the most important thing I would consider is looking at the competencies against which the candidates are evaluated and how the examination is scored. So those two things will really help you identify how you need to prepare for the exams. So there are 7 competencies against which you would be evaluated in the exam. there could be combination of different competencies that are evaluated in a single station. I'm going to run through all of them, but just focus on two key components. So the first one is the competency one, which is patient care, accounts for about 26% of the exam's total weightage in the OSCE exam. And what does patient care roughly translate as far as the OSCE is concerned? That you should have knowledge required to identify a potential drug related problem. An example could be a patient is prescribed clarithromycin and he's already on atorvastatin. As a pharmacist ready for the entry to the practice level, he should be able to identify a drug related problem, that Paxil and Lipitor, there is a drug interaction and cannot be taken at the same time. A need might be there to refer the patients to appropriate healthcare professionals. Sometimes a patient may be required to refer to an emergency or a physician or another healthcare professional like a physiotherapist. These are some of the things you should be able to identify and make appropriate referral. Competency 2 is professional collaboration and teamwork. Ethical, legal and professional responsibilities are the competency number 3. Drug, therapeutic and practice information forms competency 4, against which you are evaluated. The most important as far as the OSCE is concerned in terms of weightage, communication and education, it accounts for about 40% of the total weightage for the exam, and that's why you need to be very good in this area. Essentially what it means is when you're communicating, you're loud and clear. You're using appropriate language. That is, when you're talking to a patient, you're talking in a layman's language. When you're talking to a healthcare professional, you're using the medical terminologies. Empathy is very, very important. Effective information gathering and providing is a key component. And more organized you are, it becomes easier for you and the patient or the other healthcare professional to provide you information and to understand the information that you're trying to provide. So being organized is very, very important. Drug distribution forms competency number 6, and understanding the management principle forms competency number 7. Examination scoring, how exactly would you be scored? So as far as the interactive stations are concerned, you are scored on 3 parameters: communication, outcome and overall performance, and you are scored on a scale of 1 to 4. 1 is the lowest marks that you can achieve or obtain, and 4 is the maximum marks that you can score. As far as the non-interactive stations are concerned, the first part or the first rating, that is communication, goes out, and outcome and overall performance stays. The assessors are well trained to follow the standardized criteria and rate you or rate the candidates accordingly. There will be negative marking for misinformation and risk to the patient and is part of the overall performance. Now this is very important that your ratings are all added up for all scored stations, which means all 14 stations as of now, to arrive at a total score. A standardization process ensures that the pass and fail standards are comparable from exam to exam. Essentially what this means, no matter what center you pick up or what time of the year you take the exam, your results would pretty much be standardized. Now this is the most fascinating part of the orientation program. Over years of our helping students appear and prepare for the exams for the OSCE and interacting with them. These are the top 5 reasons why which we came across, which according to us essentially are the 5 key reasons why people flunk the OSCE exams. Let's run through that. The reason we want to run through that is we want to make sure that we know that, and we basically prepare ourselves. We know what are the key obstacles, and then we formulate a strategy how to avoid those 5 most common obstacles. So the number 1 reason, not the number 1, but one of the top 5 reasons is why people flunk the exam is the immense pressure. So no matter how well they're prepared, and they may have all the knowledge, but when they go in the exam, the pressure somehow is so much that their performance level drops dramatically, and they don't perform um, to their best. So that's one of the key reasons. The second most common reason why people flunk is um, communication skills. Um, if they are not able to communicate effectively, um, the patient may not, or the healthcare professional may not understand what they are saying. And more importantly, if you're not an effective communicator, the 7 minutes time frame that you have may not be enough for you to complete the station. So communication, and also as we discussed in the previous section, 38% weightage is to communication, is allocated to communication and education. Third, time management. Remember, it's 7 minute stations. Here you're to gather information, look at your reference, and provide a counseling or reference. 7 minutes, a lot of times, are not enough. And one of the key reasons why people fail is they do not have a proper time management skills, or they fail to manage their 7 minutes well. As a result, though they may know the station very well, they are not able to complete the station. As a result, they don't, or they are not able to get full score despite all the knowledge. And obviously, if they're not well prepared, they don't know what to prepare. It's not that they're not preparing, like people do prepare, but if they are not preparing in the right direction, they're not preparing in the right way, then obviously that's going to contribute towards their failure. These are the 4 common reasons why people fail the exam. Now obviously, as you can see, we are talking about 5, so I will come to that in the last, but let's first look at these 4 reasons why people fail, and essentially, more than anything else, what as a candidate you can do to overcome those problems so that when you appear for your OSCE exams, you basically succeed. So just to sum up, I'm just going to sum up the first 4. The final one, I'm going to keep it right at the end, and then we'll discuss that. So 4 reasons are immense pressure, communication, time management, and lack of preparation. So how do you master that? So as we first talked about, there is immense pressure. How do you manage pressure? So the most common refrain, or the thing that you will hear from candidates, is, I need to practice more. And yes, the practice does help, but it's not just the practice. You need to be doing a bit more than practice. The key thing you need to do is to manage pressure is to follow a structured process. Is the process is a solution, standardization is the process. What you need to do is, there is so much of pressure and you're all the time thinking, what should be my next question, what I should be doing. And as a result, you're not listening effectively to what the patient or a healthcare professional or a standardized client is saying, and you might miss key clues that are being said or told to you by the patient. The best way to avoid is to follow a standardized process. What do I mean by standardized process? You need to exactly divide your stations into 2 or 3 small compartments. In each of the session, or in each of the compartments, you need to ask particular questions or say particular things, follow a particular routine. This will allow you to know what exactly you're doing, and then you can start doing that without thinking about it. It's just like a training in the military. You know what exactly you're supposed to do, and you basically do that. Or it's going to Tim Hortons. No matter where you go, you get the same product. Why? Because the whole process is standardized. So similarly, when you're preparing for the stations, if you standardize the whole process of 7 minutes of the station, no matter what the station is, you would be able to still deal with it more effectively. So let's say you break it and the first part is introduction. So making sure you introduce yourself, you identify the patient or the caregiver, you offer you know confidentiality and privacy. So that's the first part. Then the second part is gathering medical information. So make sure you gather the relevant medical information through a structured process of asking questions. Let those questions be standardized, whatever those 8-10 questions are, and make sure you ask them in the same logical order every single time. This will ensure that you gather all the information and don't miss out on any vital information. And then finally, looking at the reference and providing the information. Even providing the information should be structured and in a particular order. This will ensure that when you're practicing consistently in the same way. As a result, when you're in the exam, you're not thinking what should be my next question or what is the next thing I need to do. It is now ingrained into your mind what structure or what questions need to be followed or what process needs to be followed. As a result, this allows you to fully focus on what the patient is saying and therefore gather more information and gather the clues that are being said by the patient. So standardization is very, very important. How do I improve communication? It's approximately 40% weightage in the exam. What do I do about it if communication is a weakness? The most common thing people will say is we need to improve. But a lot of time you need to keep in mind that and this is true more especially for international pharmacy graduates, not so much for Canadian or North American pharmacy graduates. But there's only so much you can improve because you have English is probably not your first language and there is a particular level that you have for your communication in English till so many years. So how you can suddenly improve dramatically your communication. So just saying I need to improve, I need to practice more, or I need to work on my English is not necessarily the solution. What you need to do is organize your thoughts. When you organize your thoughts and are able to ask the information and provide the information in an organized way, your communication will look much more better. So that's one thing you need to do. Second is standardize your response. So if you have a weakness in communication, it gets masked. So for example, how many side effects are there? Probably the common side effects are, let's say, 10, 15. So for example, you're talking about a codeine preparation. What are the two common side effects? The two most common side effects, drowsiness, and second is constipation. Now, when you're talking to the patient or discussing these side effects, if you have standardized your response to the top 10 or 20 side effects, it becomes so much easier. For example, if you're talking about Tylenol 3, which has codeine in it, and the side effects you're mentioning, then you can say, when you take this medication, you may or may not experience some side effects. The most common side effects are drowsiness and constipation. For drowsiness, make sure you do not drive or operate a machinery if you know that you're not 100% alert. You may or may not experience constipation, and in order to reduce that effect, you might want to drink more water, up to 2 liters of water a day, and if that doesn't help, some stool softeners are available. We can provide that. So whatever you decide, you make sure you standardize your responses and organize your thoughts. This will dramatically improve your communication rather than working on your English to improve your communication. time management. So obviously, oh, I need to practice more. That's what I keep on hearing. So that I can manage my time better, I need to finish my station in 7 minutes. Um, and that's what I hear the most of the time. I need to practice more. I don't think practice alone is going to help. I'm not trying to run down. I think practice is very, very crucial, but that's not the solution for everything. You Before you practice, you need to have two things in place as far as the time management is concerned. Part one, uh, the exam, the PBC provides you 7 minutes. I don't think it's a good idea for you to practice with 7 minutes in mind. Your goal as a candidate should be to complete the station in six, and at the worst at 6 minutes and 30 seconds. So, I mean, that's what we need to aim for. And when you aim for that, suddenly, you have a room to play around for 30 seconds to a minute. So just in case in the exam something goes wrong, or, it's the pressure of the exam, you take a little bit more time, you're still able to finish the station in time. Second, uh, what is measured you can improve upon. What is not measured, it's difficult to improve. So when you're looking at a 6 minute component, just don't look at it as a whole 6 minute component. Remember, there are three buzzers: a buzzer at the start of the station, 5 minute buzzer, and a 7 minute buzzer. But as a candidate, when you're preparing, you should prepare in a components of 2 minutes. What essentially I would do is 2 minutes to introduce myself and gather information, 2 minutes to look at the reference, and 2 minutes to provide counseling. Essentially, this is the 6 minutes. Of course, based on different types of stations, you would need to work out differently. For example, in OTC stations, you might probably need 2.5 minutes to gather information, because you're looking at gathering more information about the symptoms, and also need to rule out the red flags. So you need to make those minor changes. But once you have those changes, those things in place, then you need to measure when you're practicing. Every single time you need to practice, you're practicing, you're not only measuring how well you performed in the exam, did you cover all the points or not, but you also need to measure, did you work each component within the specific time frame that you had in your mind. Once you have this, suddenly you will see that you are able to manage the time a bit better, and in the exam you will see the benefits of this practice. So the fourth part is lack of preparation. A good preparation requires right approach and attitude. That's very, very important. So we need to be very positive towards exam. When you go out and when you interact with people, some people will not have such a great experience with the exam, and they would share a lot of negative things. But you need to keep in mind that PBC is a national body. It doesn't have anything against anyone. They are just a examining body. It's a standardized exam, and they are taking the exam. That exam is same for everyone. So you need to go with a very positive approach. You need to know what the exam is, how they are going to score you, and then you need to prepare your game plan accordingly. Also, the right approach is very important. So don't go with, oh, I'm going to prepare for 100 odd stations, and hopefully those stations are similar to this or same like this. The idea is, when you're preparing, you need to prepare with the basics, and when you do that, at the end you should feel confident so much that you should feel that, okay, no matter what they ask, I am ready for any kind of station. And that will only come when you have the fundamentals in place and you have the right approach for the exam in place. Otherwise it's very difficult. Otherwise you're going to struggle. You're always going to feel, oh, I have prepared so many limited number of stations. As long as those kind of stations are that come, I am good. But if there are mild variations, you might find it difficult to cope up with. And of course, finally, you need enough time to be well prepared. So make sure that you are allocating enough time for your OSCE preparation. And finally, what you have been waiting for. What is the number one reason why people fail at OSCE? And that's the sad part, is that not many people know that this is the key component, that the key reason why people fail is not necessarily their lack of preparation, not necessarily the time management, not necessarily the pressure. In so many years, I've hardly came across few people, but apart from that, no one ever mentioned that I did not know what was in the station. I knew what exactly was in the station, but somehow I couldn't uh, get the passing marks. What does this mean? Because the most common response I hear is, I knew most of the station, I had required knowledge, but I could not make it. So obviously all the four things that we discussed must be contributing towards the failure, but I think one key component is missing is this. The topmost reason why people fail, according to SolRx, the practice we had at SolRx, the interaction we had with hundreds of OSCE candidates, is the lack of understanding of what will get them a fully solved station. When you're solving a station, uh, do you know exactly what things you need to do that will help you get a fully solved station? That's the single most important thing that you need to know, and that's the single most important thing that people don't understand. That lack of understanding contributes to their failure. Now, based on the parameters provided on the PBC's website, we have extrapolated them and used our own understanding to create a structure or to provide a information to our candidates that will help them understand what they need to do in a station to get a fully solved station. So it's like basically, you need to do A, B, C, D, E, 5 things to fully solve the station. Now as a candidate, you might know all the 5 things, A, B, C, D, E. You know all of them. But because you don't know I need to do all those 5 things, what you come out from the station doing is A, B, and C. D and E are left out. You know them, but you didn't perform in the station because one, either you didn't know you needed to do that or you thought they were not important. What it leads to is partially solved station. And that's what contributes to failure at times. So that's the single most reason. Our in-class review programs are designed to help candidates understand what will get them a fully solved station. How to best prepare for OSCE. The key component in your success for OSCE is one, attitude. Attitude and approach plays a key role in your preparation. So no matter what interactions you have with the outside world and the candidates who have appeared for the exam before, always be very positive. In terms of approach, the key things you could do is identify the process that you need to have for different kind of stations. You need to formulate a plan for each type of station, so broadly categorize what kind of stations could be there, how I'm going to prepare it, and in the exam, in those 6 minutes, what kind of process I'm going to follow for that. So, references. It's very important to know your references. Yes, it's a open book exam, so which means you can look at your reference at any given point of time. So which is a great thing. However, you need to keep in mind that if you rely too much, then you may run out of time. So one thing you need to keep in mind is you can't look at everything in the exam because yes, there is a reference, but there is a time limit too. Secondly, even whatever that few things that you need to look at the reference for, you need to be well prepared. You need to know which reference to pick up, you need to know where exactly to look, and you need to be very accurate and fast in doing it. And this can only come with practice. So make sure you run through all the important references and are very familiar with using them. Once you master those references, it will save you time and also will help you effectively retrieve key information. Remember, sometimes there could be 2 or 3 references in the exam station, and your ability to pick up the right reference can determine your success. So, as I said, you need to have a right process or plan for each kind of station. So, as we know, broadly categorizing the exam into 2 parts: interactive stations, non-interactive stations. So now interactive stations, there are 4 or 5 different broad categories that you could have. One is counseling on prescription drug, counseling on OTC, or making over-the-counter recommendations, doctor stations, management stations, and demonstration of devices. So let's see how best you can prepare for each of these broad categories. So counseling on prescription drugs. In this category, it's not just counseling. So, for example, the patient is here to pick up a prescription for Synthroid. It's not just about counseling about Synthroid. It's also important to gather the relevant medical history. So, the key thing you need to do is follow the structure or follow the format where you're asking a certain number of questions to gather all the relevant history, and make sure you ask in the same order every single time so that it becomes your second nature and you don't miss out on asking any questions. Missing out any questions, which means potentially you are becoming vulnerable to making a mistake because you may not be able to identify certain DRP or identify certain important information that you need to share with your patient. So it's very important to ask those questions. Once that's done, it's important to counsel or master the counseling on drugs, like at least counsel prepare for top 100 drugs from different categories. So from each category there should be 2 3 drugs that you're preparing. This will do a couple of things. Some of the drugs, for example methotrexate, if you have never looked at the monograph of methotrexate, and in the exam you are going to look at the monograph of methotrexate before your counseling, trust me, you will have never enough time to look at the reference fully, or if you look within 2 minutes you might miss out on so much information. So there are some drugs which are very typical that have a lot of information and a lot of different things to keep in mind. Make sure you do those drugs, you prepare for them separately and you prepare for them very well. The book that comes with our program has the list of those 100 drugs. You could add more if you wish. Also, what it does is, because you're preparing from different categories, you have the basic thing in mind that okay, if there are ACE inhibitors, these are the common side effects I need to talk about. Another thing you could do is know the top 100 odd drug related problems, or DRPs. This will help to identify some of the very common ones. For example, there is a drug interaction between clarithromycin and atorvastatin. So like this, you should be prepared with the top 100 odd common DRPs and be well prepared, so just in case if you see in the station you are able to identify it right away. If you can't, don't worry, you will still run through the reference and you can check the monograph to see if there is any DRP or not. Same, pretty similar that goes for the OTC stations. It's pretty much same in the line of prescription drug counseling, but the key thing here you need to keep in mind is you need to rule out the red flags. So that's very important, and for at least 25-30 the most common minor ailments, you need to know the red flags, if not all, most of them. And then when you're looking at the reference, just run through quickly if you have missed out on any red flags. If you did, then make sure you ask them and rule those red flags out. Also prepare 3 self-care measures for most common ailments, and you need to be well prepared with that. Healthcare station, once again it's very important to ask questions to gather relevant medical history or information. You need to be well versed with your references, especially CPS and therapeutic choices, and documentation is the key. The key thing as far as the healthcare station is concerned is I would recommend that you run through the therapeutic choices. Um, you don't have to memorize just like you have to do for the MCQ uh, because it's an open book exam, but make sure you run through all the algorithms and the drug charts, and also run through the list of the chapters. So for example, if there is a station on edema and the therapeutic choices book is there, you should know that there is a chapter on edema. And if you have run through the algorithm, at least there is a confidence that I have read this chapter, I know the algorithm, and I can run through it. So this is really going to help you in the pressure situation of the exam. And finally, don't forget to document whatever you make a recommendation. It's very important that you document it. So when you are practicing, just don't say the answer, make a habit of documenting it even while during your practice. Management stations, they can be critical and some people find it very difficult to deal with. It's very, to make it simple, here are the few steps we can follow. Whenever you come across a management station, the first thing you need to do is you need to gather facts. Do not go by the opinions or what someone said. Yes, you need to act based on the information provided by someone else, but you basically gather facts. Don't go by hearsay. Once you gather all the facts and you have understood the situation, try to identify what exactly is the problem. And this is where a lot of pharmacists make mistakes. They think that identifying the problem is a key part, and that's where they end the station. But remember, it's not just knowing what's the problem. You're not just a pharmacist. You also act as a supervisor or as a manager. And one of the key job function as a manager or supervisor is to not only just identify the problem, but to provide a solution. So you must always, once you identify the problem, you must always think of ways of how to provide solution or how to find a solution, what ways you can work to overcome the problem. And a good manager or a good company is the one who would do two things: not only just find solution for the current problem, but look at the ways to see if there is any way to avoid such problem in the future. That's one component. And secondly, if there is any errors being done, and that's where the problem occurred, they would think of ways how to prevent it and how to share it with others. So just one person makes the mistake, but everyone else in the pharmacy learns from the mistake. So those are the two things good managers and good companies try to do. So once you've found a solution, think of how you could avoid in the future if it's applicable. And secondly, could you share it with everyone else so that the same mistake is not made by any other personnel in the pharmacy. The demonstration of devices sometimes can be challenging, and also depends on the kind of station. Some stations would involve counseling plus demonstration, and some stations might just possibly have only demonstration. Now, how do you prepare for demonstration of device? So prepare thoroughly demonstration of various devices that are provided with the SolRx book, and look out for new introductions in the market. A good idea would be to watch the videos on the YouTube by the manufacturers and use the monographs and the websites of the manufacturer to see ideal ways of demonstrating the device. More that you're prepared, more you will feel comfortable and confident doing those demonstrations. The demonstrations can be overwhelming for both the candidates as well as the patient. To make it easier, we at SolRx usually recommend breaking down the demo into small parts. Actually, even before you start demonstrating, we recommend that you divide. The first step you do is basically, explain the different parts of the device. That's a good beginning. So let's say divide the device into 3-4 different parts and explain what each part does, and then start with the demonstration. Try to divide the demonstration in 3-4 small simple steps, and at the end of each step, make sure you check with the patient if they understood. and if they want you to repeat any step, make sure you do that. The key benefit of checking at the end of each step, if the patient has any problem in the first step, then you can quickly run through the first step. But at the end, if you ask and he didn't understand even the first part, then you are sort of stuck, because now you need to redo the whole demonstration. So make sure you don't get into such kind of trouble. Always check with the patient if they understood each step, and move forward. And obviously, if you have at the end luxury of the time, ask the patient to repeat or demonstrate it back to you, so that you are ensured that they understood it properly. However, make sure you don't insist them to do it. If they say, no, that's fine, I understood what you said, then that's it. Now, coming to non-interactive stations, remember, these are some of the things we talked about: prescription dispense checking, prescription screening, article reading, and retrieving information. The key thing is there are some exercises provided in the SolRx book for the OSCE. Make sure you read them. Some examples are explained, and then there are some exercises for you. So make sure you complete all those exercises. This will give you a good idea of what you need to prepare for the non-interactive stations. Questions? Sure, I'm sure at the end of the book you might have some questions, and if you're not a part of the in-class program, you can always email us info@solrx.ca. Send your queries to info@solrx.ca, and we'll be happy to answer any queries you might have. And if you like the book, you can always come back and register for the in-class review program if you have not already registered. Any questions, call us 1-888-267-2464 or log on to solrx.ca. Thank you, and wishing you all the best. And at the end of this you would be also seeing a small series of interactive stations that basically provides you how you should respond to in a scenario, and there is a quick review by the pharmacist. So make sure you run through those interactive stations videos. All the best for your exams.